Good day, everyone. So, we are the last group to report, and our report is all about abortion and reproductive technology. So, here are the reporters. So, first is Miss Sarah May Candalasa, Angelique Cuesta, Dayandon Kimel Ann, Diposoy Ria Jean, Del Castillo Sarah May, Dino Gian, Elcarte Jonah Chris, and Felisco Jessa May. So here are the contents of our report. So first is the introduction of abortion, the classification of abortion, the ethical theory, the advantages and disadvantages of abortion. Next slide, please. Then the introduction for the reproductive technology, the types of reproductive technology, and the ethical theories on assisted reproductive technologies. So for the introduction, abortion, it is the expulsion of a fetus from the uterus before it has reached the stage of viability. So in human beings, it is usually about 20th week of gestation. So an abortion may occur spontaneously, in which case it is also called a miscarriage, or it may be brought on purposefully, uh, in which case it is often called an induced abortion. So, spontaneous abortion or miscarriages occurs for many reasons, including disease, trauma, genetic defect, or biochemical incompatibility of mother and fetus. So, occasionally, a fetus dies in the uterus but fails to expel. So, this is a condition termed a missed abortion. So, induced abortion may be performed for reasons that fall into four general categories. So, first is to preserve the life or physical or mental well being of the mother, to prevent the completion of a pregnancy that has resulted from rape or incest, and to prevent the birth of a child with serious deformity, mental deficiency, or genetic abnormality. And lastly, to prevent a birth for social economic reasons, such as extreme youth of the pregnant female or the sorely strained resources of the family unit. Okay, so by some definition, abortion that are performed to preserve the well-being of the female or in cases of rape or incest are therapeutic or justifiable abortion. Okay, next slide, please. Okay, so the Philippine government has made efforts to improve access to contraceptive services, but abortion is illegal under all circumstances and is thus highly stigmatized. Nonetheless, abortion is common, but it is often performed in unsanitary condition and using outdated techniques. So several U.S. states, including the Alabama, Georgia, and the Missouri, have recently passed the draconian abortion laws. So in Alabama, the new rules effectively ban abortion unless the life of the mother or the fetus is at risk, and make no exemption for rape or incest. So incest is the crime of having sexual intercourse with a parent, child, sibling, or grandchild. Okay. But the most relevant example may be a country whose religious and political history is closely tied to the United States. So in the Philippines, it is a former U.S. colony. So abortion has been banned entirely for over a century. So over 90% of the population identifies as a Christian. Proposals to change abortion laws are consistently opposed by the highly influential Catholic Church. So the Philippine law mandates prison terms up to 6 years for people who have abortion and for anyone who assists in the procedure. The the Philippine abortion ban likewise for a while. The Philippine abortion ban has likewise not stopped the practice. It has just made it far more dangerous for those who choose to end their pregnancy. So about 600,000 Filipinos women get abortions every year, and many turn to unlicensed doctor which use folk medicines or attempt to self-induce. It is estimated that as many as 100,000 women were hospitalized annually due to abortion complications, and about 1,000 women die each year after getting abortions. So this is according to the Guttmacher Institute, a think tank which support expanded access to abortion and reproductive health. So those seeking abortion in the Philippines may not only face imprisonment but also face the constant danger of death. So as free and accessible services are out of reach. So some trained doctors in the Philippines secretly offer safe abortions in clinic, risking their careers out of their belief that women should have the right to ensure their own well-being. So now let's move to classification of abortion.
Okay, now for the classification of abortion. Next slide, please. So first type of abortion is threatened abortion. So threatened abortion is the term used when a pregnancy is complicated by vaginal bleeding before the 20th week of gestation. So pain may not be prominent feature of a threatened abortion, although a lower abdominal dull ache sometimes accompanies with bleeding. So vaginal examination at this stage usually reveals a closed cervix. So 25% to 50% of threatened abortion eventually result in loss of pregnancy. The next type of abortion is the inevitable abortion. So in case of inevitable abortion, a clinical pregnancy is complicated by both vaginal bleeding and cramp-like lower abdominal pain. So the cervix is frequently partially dilated, attesting to the inevitability of the process. Next slide, please. So third type of abortion is the incomplete abortion. In addition to vaginal bleeding, cramp-like pain, and cervical dilatation, an incomplete abortion involves the passage of products of conception, often described by the woman as looking like pieces of skin or liver. So the fourth type of abortion is the complete abortion. So incomplete abortion, after passage of all the products of conception, the uterine contractions and bleeding abate, the cervix closes, and the uterus is smaller than the period of amenorrhea would suggest. So in addition, the symptoms of pregnancy are no longer present, and the pregnancy test becomes negative. Next slide. So fifth type of abortion is the missed abortion. So the term missed abortion is used when the fetus has died but is retained in the uterus, usually for some weeks. After 16 weeks gestation, dilatation and curettage may become a problem. So fibrinogen levels should be checked weekly until the fetus and placenta are expelled. The next type of abortion is the recurrent abortion. So recurrent abortion refers to any case in which there have been 3 consecutive spontaneous abortions. Possible causes are known to be genetic error and anatomic abnormalities of the genital tract rather, hormonal abnormalities, infection, immunologic factors, or systemic disease. So that's it for the classification of abortion. Now moving on to the bioethical principles applied in abortion.
Okay, next is we have the bioethical principles applied in abortion. So we have their autonomy, justice, beneficence, and non-maleficence. So abortion is one of the most controversial issues in today's world. People tend to turn to the law when trying to decide what is the best possible solution to an unwanted pregnancy. Next slide, please. Okay, first is we have the principle of autonomy in abortion. By taking into consideration the rights of the fetus, and an antagonistic relationship between the woman and her unborn child may occur. Therefore, women should have more autonomy in the issue. Autonomy derives from the Greek and means literally self-rule. The ethical principle of autonomy states that patients are entitled to make decisions about their own medical care when able. Respect for autonomy is enshrined in laws governing informed consent, which protect patients' right to know the medical options available and make an informed voluntary decision. Next is some bioethicists argue that if a pregnant person wishes to end their pregnancy, the state should not interfere. According to one interpretation of this view, the principle of autonomy means that a person owns their body and should be free to decide what happens in and to it. Next is if a woman who is pregnant wishes to stop being pregnant, why should we prevent her? So if we regard her pregnancy as a morally neutral state, there ought to be no satisfactory reason to prevent her. The way that humans reproduce, in common with other mammals, is simply a product of evolution. Biologically, the developing fetus is somewhat like an invading organism. If it were not for a complex system of compensating mechanisms, the woman's body would reject it in the same way as the body rejects a transplanted organ. Next slide, please. Okay, other factors and consequent pressure combined with the option to terminate a pregnancy to ironically undermine the autonomy of the poor, abused pregnant women, instead of the availability of the abortion choice working to respect a woman's capacity for self-determination. The reality of the situation may serve to undermine this capacity for some women. Giving a woman option may sometimes make it more difficult for her to take the one she would otherwise rationally choose according to her desires and values. Preventing someone who wishes to give birth from having a child is an offense to her fundamental capacity for self-determination. By valuing her options as goods in themselves, we fail to value and respect her capacity for autonomous decision making. Okay, much like in cases of sexual intercourse, a woman's consent is needed for it not to be rape. However, she can withdraw that consent at any time during intercourse. Okay, the same applies when a woman falls pregnant due to ineffective contraception. For example, if a condom breaks or the pill fails to inhibit fertilization, the woman has clearly not consented to be impregnated with a fetus, given she and her sexual partner took steps to stop conception, regardless of its failure. Along this reasoning, if a woman falls pregnant by accident, she has the right to evict the fetus from her body. Stephen Kirshner, an American philosopher, follows this, claiming that in cases of rape, women have the right to use lethal force to terminate. Next slide, please. Okay, next is we have another principle, which is the principle of justice in abortion. Justice, a final principle of bioethics, requires treating similar cases similarly. So if the pregnant person and the fetus are moral equals, many argue that it would be unjust to kill the fetus except in self-defense. So if the fetus threatens the pregnant person's life. Others hold that even in self-defense, terminating the fetus's life is wrong because a fetus is not morally responsible for any threat it poses. Yet, defenders of abortion point out that even if abortion results in the death of an innocent person, that is not its goal. So if the ethics of an action is judged by its goal, then abortion might be justified in cases where it realizes an ethical aim, such as saving a woman's life or protecting a family's ability to care for their current children. Defenders of abortion also argue that even if the fetus has a right to life, a person does not have the right to everything they need to stay alive. For example, having a right to life does not entail a right to threaten another's health or life, or ride roughshod or over another's life plans and goals. Okay, next slide, please. Okay, justice also deals with the fair distribution of benefits and burdens. For example of this is among wealthy countries, the U.S. highest rate of deaths linked to pregnancy and childbirth. Without legal protection for abortion, pregnancy and childbirth for Americans could become even more risky. Study shows that women are more likely to die while pregnant or shortly thereafter in states with the most restrictive abortion policies. We have their minority groups may have the most to lose if the right to choose abortion is not upheld because they utilize a disproportionate share of abortion services. Now, there's other marginalized groups, including low-income families, could also be hard hit by abortion restrictions because abortions are expected to get pricier. Okay, next slide, please. Okay, next is justice seeks to achieve fairness among people when equity has lost or is about to lose its equilibrium in terms of social cooperation. These matters are difficult to arbitrate because they are composed of objective and more often subjective criteria. So for pregnancy continuation, justice is generally served if both mother and child survive and lead healthy and productive lives. For pregnancy termination, however, achieving justice is difficult to define and mostly one-sided. The mother lives on and the offspring dies. Next slide, please. So for just moral outcomes, two fundamental principles are often articulated. One is permitting the maximized amount of basic liberty, and number two, allowing inequalities in social primary goods only if they benefit all. Next slide, please. Okay, so the next principle will be reported by Ms. Rhea Jean Leposoy.
Okay, sorry for that. So now let's move on to the principle of non-maleficence in abortion. Abortion has lifelong complications and devastating physiological and psychological effects. On the other hand, safe abortions are not injurious to women's health. While it is said by the advocates of abortion that, like other invasive and operative procedures, abortion is also a procedure, which is done in a proper manner by following all surgical principles and aseptic techniques do not produce dangerous effects on health. While illegal abortion has harmful effects on women's health, next slide please. When a woman engages in a voluntary sex, doesn't use contraceptives and gets pregnant, one can say that she signed a contract with her fetus. Moreover, they support that the fetus has the right to live and mother should not decide on behalf of the fetus, while the woman has the right to decide for her fetus, for herself and her body. Next slide, please. So in this case, fetus is part of mother's body and even human being holds the right to decide for his or her own self as stated by Bunkard and Nathaniel. Mother has the right to decide on behalf of fetus, but it should be for the best interest of the fetus. Proponent supports that every woman should be able to decide for her pregnancy. If a woman engages in sexual intercourse for the purpose of having a child, then the resulting fertilized egg has the right to mature and be born. Next slide, please. It means right to born crystallizes at the moment of voluntary and intentional fertilization. However, opponent supports the idea that from conception, the soul enters the fetus, and thus the abortion is more of killing. Inherent literature supports different time of entrance of soul in the fetus. Key pro-life group insist that fetus is an individual itself and no one should violate the right of the fetus. Next slide, please. So this is an issue that focuses the autonomy and dignity of the pregnant woman. It has been highlighted that termination rates followed by antenatal diagnosis of congenital malformation such as Down syndrome, which is 92%, spina bifida, that is 64%, anencephaly, 84%, Turner syndrome, 72%, and Nefelter syndrome, 58%. So it is justified to prevent a terminated fetus with abnormalities, then society should support the promotion of freedom and prevention of sufferings, which should be the fundamental goals. Next slide, please. Next is the principle of beneficence in abortion. It is a principle requiring that persons respect one another by proactively contributing to their welfare. It is relevant to women with unwanted preborns. While a mother is in such undesirable situation, might be under enormous stress, she could benefit from empathy, compassion, caring, and psychological encouragement to adjust her circumstances while she seeks and obtain a mutually advantageous solution, not merely abortion. Next slide, please. The viable human embryo and fetus are entitled to beneficence-based treatment. Beneficence-based rights are prima facie and create obligations toward the preborn that are limited by its medical condition. The probability of correct diagnosis and the probability of fetal death from medical treatment. It was further argued that the fetal patient should not be viewed as separate from the mother, who is designated as the primary patient. Next slide, please. And pose it farther than fetal rights and consider dependent and not independent, and yet have moral interest. So Strong in 2008 moves further when concluding that we have moral obligations toward the pre-sentient fetus has intrinsic moral status by virtue of having a link to developing in utero into an individual having awareness. And according to Strong, since duties in this case or in medical case are owned to the fetus, that moral condition makes the fetus an entity distinct philosophically from its pregnant mother. Hence, logically, the fetus must be treated as a person with rights, including life. So basically, non-beneficence and beneficence are contradicting. So in non-beneficence, it is stated there that if you can see that the baby is having difficulties or has malfunctions, or has termination rates followed by antenatal diagnosis, say for example Down syndrome, that it is only morally right to do abortion. While on non-beneficence, although you can see that there is lacking or there are
Okay, so now I will discuss the advantages of abortion. Okay, so next slide, please. Okay, so we have surgical abortion. So what is surgical abortion? It is the elimination of the baby inside the womb of the mother through surgical procedure. So what are the advantages of surgical abortion? So it has 99% effectiveness. Since it invades the body and explores the reproductive organs of the mother, this ensures the extraction of the baby. Okay, so another thing is that surgical abortion is painless. Okay, surgical abortion is performed mainly with sedation. For this reason, women stand out as advantages of feeling less pain. Sedation, other than general anesthesia, causes an induction to a mild sleep, which guarantees the patient not to find out about the procedure. Okay, so another advantage of surgical abortion is that the procedure is quick. Okay, let's say if the client has a busy schedule, if surgery does not worry you, the client, and the client wants a quick procedure, uh, this method is preferred, can be preferred by the client, since surgery takes um, surgery takes approximately 10 minutes with a total visit time of approximately 3 hours. So another advantage of surgical abortion is that it has a low complication rate. One visit only and a very low complication rate, which is 1 to 2%. Okay, and since the procedure is monitored by the physicians, anesthesiologists, nurses, etc., the health status of the client is considered as safe, stable, and insured. Okay, so next slide, please. Okay, so now we have the medical abortion. So what is medical abortion? Medical abortion is the inducing of abortion through the use of medicines, such as mifeprostone, misoprostol, etc. Okay, so what are the advantages of medical abortion? We have an easy process. Okay, so 95% of women who choose medical abortion will avoid the possible risks of surgery, and the client will only follow the procedure provided by the physician regarding the medications that the client is going to take for the abortion. Okay, so what the client will do is just follow the instructions given or provided by the physician and follow those instructions. Okay, so next we have another advantage, medical abortion. Okay, sorry, go. Okay, another advantage is that medical abortion is less invasive and also prevents physical trauma. The client will not get the fear of undergoing surgical procedures, since the procedure only requires oral medications. And another advantage is that the client can be accompanied through the process. Okay, so this is the main difference between surgical abortion and medical abortion, because in surgical abortion, um, the client is isolated and is only accompanied by the physician and other people who are involved in the procedure. Okay, while medical abortion, it gives an option for the patient to have a support system. Okay, so the client may have people around her to comfort and empathize along with her during the procedure to alleviate emotional burden. We have another advantage for medical abortion, it is less expensive. Okay, oral medications for abortion is much cheaper compared to undergoing surgery. Okay, and lastly, another one advantage for medical abortion is it feels more natural, or the process is more natural, because the mother may feel less guilt and anxiety because the process feels like a miscarriage, or uh, the procedure may feel like it just happened, like through the medications she took in, it may feel like she's going to miscarriage. Okay, so next we have the disadvantages of abortion, which will be discussed by my groupmate.
Okay, so we are done with the advantages. So let's move to disadvantages of abortion. So it is important to keep in mind that these potential abortion problems should not be necessarily considered reasons not to have an abortion. So they are just realistic cons about the abortion that every woman should be aware of when she's deciding how to move forward with an unplanned pregnancy. So next slide, please. So first is the side effects and complications. So abortion is the procedure that includes the internal treatment of your body, just like any other treatment. So it is safe, but some side effect like pain, discomfort, bleeding are normal to happen, and injury to internal organs or reaction to the medications are the rare cases. So complications includes um, damage to the womb or cervix, infection of the uterus or fallopian tubes, uterine perforation, or even death. So make sure that you consult your doctors about the side effects as well as the procedure. So second is it getting an abortion or having an abortion is expensive. So the medical procedure of abortion is expensive. So it ranges from $500 to several $1,000s. So if we convert it to peso, so it is about 27,000 pesos to hundreds. And even if you have health insurance, insurance won't cover your expenses. So 55% women delay their abortion due to financial problems. Next slide, please. Okay, so third is it is hard to access abortion. So by the reason that abortion is still legal here in the illegal here in the Philippines, finding a place that is safe and feasible for getting an abortion is difficult. So the problem may be the harassment or restriction on abortion providers or clinics. So this can delay your abortion by crossing the limit of the trimester, and some may be forced to do unsafe abortion, putting their life in risk. Okay, and lastly, judgment from others. So as what Miss Diposoy said earlier, that abortion has lifelong complications and devastating physiological and psychological effects on the mother. So some women are forced to face such harsh criticism from society as well as friends and family, as abortion always has been a controversial and heated topic in the society. So this is um, your decision will grab the attention of the public about the right of all versus the right of the unborn child. So it will be hard for you to convince all the people in the society about such controversy. So for forcing them to perform unsafe abortion procedure which hamper their health. So it may also cause emotional and um, psychological impacts such as guilt, depression, flashback of abortion, suicidal thoughts, alcohol, and drug abuse to the mother or to the pregnant woman who wishes to to have an abortion. Okay, so now let's move to assisted reproductive technology.
Okay, so now moving on to the next topic. Okay, so moving on, so we're done talking about abortion. Now we're going to talk about how the process of conceiving now after abortion. Okay, so first, let's define what is infertility. So, when an individual are unable to conceive after a period of regular sexual activity or intercourse without the use of birth control, this is referred to as infertility. So, according to the available data, around 10% of American women between the ages 15 and 44 report having trouble getting pregnant or maintaining their pregnancy. Additionally, research shows that 40 to 50% of cases of infertility in couples may be caused by factors that affect men, with 8 to 12% of these cases occur globally. So we have different factors, no? We have modifiable and non-modifiable factors that basically cause infertility in both men and women. So we also here we have some examples. We have the ovulation disorder, we have the age, the uterine fibroids and endometrial polysis, and we have the hormone imbalances, the infections, and varicose. So there are many factors that can cause infertility in both men and women. However, we are still looking for a ways, no, that a woman can be pregnant. So this of course, or this will have the opportunity for the reproductive technology to occur. Okay, so when a woman cannot conceive, there is an option which is the assisted reproductive technology. So ART refers to the medical techniques intended to induce conception. In order to improve the likelihood of fertilization, this complex procedure modifies gametes or eggs and sperm. Art is often possibility for people for whom alternative infertility therapies may not work or for whom treatment has already been tried but failed to result in pregnancy. So basically, assisted reproductive technology are those procedures done as an option for those couples who failed to conceive no after trying therapies and other options. So they have the option to um, um, choose reproductive technology to conceive. However, due to the expensive cost of assisted reproductive technology and its limited coverage by the private insurance and the government, many people may find it difficult to obtain assisted reproductive technology methods. Okay. So next we are going to talk about the evolution of assisted reproductive technologies. So first we have the 18th century. So artificial insemination using the husband's sperm was the first known medical procedure in the field of human reproduction, and it was performed around the end of the 18th century, separating sexual activity from pregnancy. So this is when the reproductive technology occurs first. So basically, there is an artificial insemination, but however, it is not only before it was used in humans or applied to humans. It was also used specifically in animals. No, we have the cows. They use the sperm of the male cow to impregnate or become to give it to the female cow to become pregnant. So in 18th century, artificial insemination was the first step for the reproductive technology, and it also well to emphasize that it also separates. It was during that time that there is also a separation of sexual activity from pregnancy. So basically, there is a woman could get pregnant without having sexual activity or intercourse. Okay, next we have the 19th century. So with the use of donor sperm in the 1990s, the concept of genetic ancestry and parentage underwent yet another revolution. So basically, there is a more advanced way of being pregnant. The term sperm donor or donor sperm has already become more um, used in these times. Okay, so next we have the 20th century. So the two significant technological advancement in the medical assisted reproduction occurred in the latter half of the 20th century. We have the gamete freezing and the in vitro fertilization or IVF. Okay, so in 1953, the first child conceived with frozen thawed sperm was born, and in 1978, or specifically on July 25, 1978, Louise Joy Brown is the first world's baby to be conceived via in vitro fertilization or IVF. IVF was born at the Oldham and District General Hospital in Manchester, England. So the picture on the left, on the right rather, would be um, the picture of the first test tube baby. So the babies that are produced through the in vitro fertilization method of reproductive technology is called the test tube baby. So basically, in that time, there was a successful reproductive technology, and that results to this very first test tube baby. Okay, so next we have in 1992, male infertility can be managed for a variety of reasons with intracytoplasmic sperm injection or ICSI and it is a technique that was first introduced in 1992. So this method are going to be explained in the next slide. Okay. Okay. So next we have the types of assisted reproductive technology.
So next slide. So first is in vitro fertilization. So it involves a doctor extracting eggs and fertilizing them in a special lab. So specialists can combine this with embryo transfer or the IVF-ET and transfer the resulting embryos into a person's uterus. So the Society for Assisted Reproductive Technology states that IVF-ET accounts for 99% of ART procedures. So the picture beside this is an example of in vitro fertilization. So next slide. So the next type is the intrafallopian transfer. So some methods of assisted reproductive technology are similar to IVF, but it uses a laparoscopic surgery to deliver the gametes directly into the fallopian tube. So some people may choose this method for religious reasons, or their insurance may only cover this type of ART. So next slide. So there are types of uh, gamete intrafallopian transfer, or the GIFT. So the GIFT involves collecting eggs and sperm in a tube before a doctor places the gametes directly into the fallopian tubes using laparoscopic surgery. So the next is the zygote intrafallopian transfer, or the ZIFT. So it is a combination of IVF and GIFT, and specialists stimulate and collect the eggs using IVF methods and mix the eggs with sperm in the lab before returning fertilized egg zygotes to the fallopian tube. So the last one, so next slide. The last one is the pronuclear stage tubal transfer, or the PROST or PROST. Is It is similar to ZIFT but involves the transfer of a fertilized egg to the fallopian tube before cell division occurs. So next will be from my group mate, explained by my group mate.
So next, let's proceed to the frozen embryo transfer, or also known as FET. So it has become increasingly common in the US. It involves flowing previously IVF frozen embryos and inserting them into a person's uterus. But a 27 study found that 52% of people who had FET had ongoing pregnancies. Actually, this means that you won't have to undergo another cycle of hormone stimulation and egg collection. So next slide. So next slide, we have the intracytoplasmic sperm injection, or ICSI. So this is a procedure that specialists can perform alongside IVF to help fertilize an egg. An embryologist or embryo specialist uses a tiny needle to inject a single sperm directly into the center of an egg. So you can see it on the picture that an injection was directly inserted on the center of an egg. So ICSI is the most common and successful treatment for male infertility. So next, so for the summary, many types of art are available to treat infertility. The success rates of art vary according to the type of art people choose and factors such as the individual's age and health. A specialist will suggest art based on an individual or couple's preferences and type of type of infertility while also weighing the risks, benefits, and its costs. So next.
So now we are down to the last part of our report, which is the ethical theories on assisted reproductive technologies. So this ethical theories will help us see what kind of background or the theory principles that could support us in our decision making. Okay, so first we have the natural law theory. So in this viewpoint, which is based on morality on what is natural, is supported by the teachings of the Roman Catholic Church. So this theory condensed that all methods of regulating human reproduction are wrong. So basically, if you interfere with human reproduction in any way or form, it is considered wrong. So in reproductive technology, we are basically modifying the eggs and the sperm of the male. So that is a way of um, um, that is a way of um, basically it's a way of ruining the human reproduction, so it is considered wrong according to this theory. So the use of artificial insemination or in vitro fertilization is definitely prohibited and essentially immoral. So despite the fact that the children are typically expected in marriage if no actions are wrongfully taken to frustrate the possibility of birth, such as contraception. Many technological processes are likewise viewed as being unpleasant from this perspective. So, as an illustration, artificial insemination includes masturbation, which clearly is inappropriate. So, since we are talking about modifying the sperm, so it includes um, it includes the masturbation, which is clearly inappropriate or seen as immoral in this theory. So anything that um, interferes with the human reproduction is considered wrong in the natural law theory, including the reproductive technology. Next, we have the utilitarianism or the utilitarian view. So, according to this theory, the ideal course of action is one that maximizes the general well-being of the society. This viewpoint holds that none of the reproductive technologies are bad in and of themselves. According to this perspective, the special process and whether it is likely to do more good than harm determine whether reproductive technologies are morally acceptable. So, in this theory, it will just be the basis of the morality is that if it brings more good to everyone or it did more harm. So in reproductive technology, we see that people are basically wanting to have children, so it's doing good to the society. So utilitarianism viewpoint considered reproductive technology a moral one. So it seems reasonable to expect that philosophers who take this position will probably support the majority, if not all, procedures. So even the philosopher, we can assume that they will also agree to the reproductive technologies. Okay, so we have the last ethical theory. We have the Ross ethical theory. So according to Ross, the foundation of W.D. Ross ethical theory is the notion that our only fundamental obligation is to advance the beneficent obligations. Or to put in other way, we have a responsibility to make other people's lives better. So according to this perspective, for these technologies to be moral, they must advance others' well-being. The majority of the technologies on the following list or the mentioned technologies earlier are acceptable because they aid in a couple in need and assist them to fulfill a common objective. So this theory is another way of saying that if it costs or if it benefit the people and if it looks for or it advance for the welfare of others, so it should be considered moral. So basically the Ross theory, ethical theory, also agrees or in a way support the reproductive technologies. Okay, So that would be the end, or that wraps up our report about abortion and reproductive technology. And here are references. And I hope you guys learned something from us. And thank you so much for listening. Have a great day.